Hello, welcome to another video podcast on neuroanatomy. In this video, we will be talking about an area which is known as the frontal eye field, which can be seen in this picture over here. Now, as a first step, let's just orientate this prosection, right? So what you're looking over here is basically the left lateral view of the cerebral cortex. So this is the left cerebral hemisphere. You're looking at it from the lateral side. This is the front end of the brain, all right? And so this would be the frontal lobe, and you can see the cerebellum at the back. So that basically tells you that we're looking at the occipital lobe over here. Then we've got a sulcus over here, which is called the central sulcus. We already have talked about the central sulcus in one of our previous videos. And we know that the central sulcus breaks up the brain, separates the motor area of the brain in the front from the sensory area at the back. Although this kind of generalization is a bit misleading sometimes, but for sake of simplicity, we will just stick to this generalization, this simplistic explanation of the division of the brain into motor and the sensory areas. Right. So now in the motor area, which is basically our frontal lobe. So if you look over here in the frontal lobe, we've got three different sulci, and with the help of these three different sulci, we're going to break up this frontal lobe into four different lobes. What are the sulci? Well, we've got a sulcus over here. This is called the precentral sulcus, which is running kind of in parallel and in front of the central sulcus, which is right at the back over here. Then we've got a sulcus here called the superior frontal sulcus, and we've got a sulcus here called inferior frontal sulcus, color coded in blue and more or less in horizontal position. So as a result, we've got four different gyri. We've got a precentral gyrus, which is color coded in pink over here. That is the gyrus between the central sulcus and the precentral sulcus. This is the precentral gyrus, also called Brodmann's area 4, and that's where the primary motor area is present. Then, because of these two sulci, the superior frontal sulcus and inferior frontal sulcus, we've got three horizontally running gyri in the frontal lobe, which are the superior frontal gyrus, then the middle frontal gyrus in between the superior and inferior frontal sulci, and then the inferior frontal gyrus, which is underneath the inferior frontal sulcus. Now, where is the frontal eye field situated? Well, the frontal eye field is situated in the proximal part of the middle frontal gyrus, color coded in blue over here. And this frontal eye field is more or less in front of the region of the precentral gyrus, which is responsible for controlling the movements of the face, right? So if you remember from one of our previous video podcasts on neuroanatomy, we said that the body is represented on the precentral gyrus in a sequential but in an inverted fashion, and that representation is known as the homunculus. And the face and the hand, they are kind of represented on the lateral side over here down below, and then the trunk and the limbs are going to be represented higher up or onto the medial side. So the frontal eye field is going to be more or less in front of the face area of the precentral gyrus of the motor homunculus, and which kind of makes sense as well, because once the motor commands regarding, let's say, the eye movements have been formulated, then they can easily be sent to the face area of the precentral gyrus of the motor homunculus for those commands to be executed. Right. So now let's talk a little bit about the functioning of the frontal eye field. So what does the frontal eye field do? The frontal eye field is considered to control the voluntary conjugate saccadic movements of the eyeball, right? What does that mean? Well, let's start with a little bit of a description of the clinical neurological examination, right? So when we do a clinical examination of the eyes as part of the neurological examination, and you might have actually learned this already by now in your clinical skills station, that when we do the eye examination, a doctor or an examiner typically sits in front of the patient and asks the patient to keep his head and the neck still, and asks the patient to follow his finger in a kind of an H-shaped manner in a slow paced fashion. So what is basically being checked over here are the pursuit movements of the eye, which are known as the smooth pursuit movements. These are slow paced movements, and they involve the visual area of the cerebral cortex, to which the frontal eye field is connected via association fibers. However, the thing to be noted over here is that these are smooth pursuit eye movements, and they are slow paced movements. On the other hand, the voluntary saccadic movements of the eyes, these are independent of the visual stimuli, and hence they are different from the involuntary pursuit movements of the eyes. The saccades, which are the quick movements of the eyes, these are highly fast paced, and these are conjugate movements of the eyeballs. The word conjugate simply means that both eyes are directed in the same direction. If that does not happen, then we will run the risk of having a diplopia or a double vision. So the saccadic movements are different from the smooth pursuit eye movements, and these can be checked by asking the patient to quickly look at different for example, by simply clicking the finger in different parts of the visual field and asking the patient to quickly follow those clicking fingers. And the saccades are the movements which are going to be initiated by the frontal eye field. Now, in order to understand that, in order to understand the functioning of the frontal eye field, we need to talk a little bit about the neural connectivity of the frontal eye field with the cranial nerve nuclei, and that'll help you understand the function much better. So let's just go to this illustration over here. Right, so what we're looking over here is basically the right lateral view of the cerebral cortex. We can see the precentral gyrus over here. We can see the frontal eye field over here. Down below, you can actually see the posterior aspect of the midbrain, which is characterized by these swellings or these gray matter nuclei over here, these two being the superior colliculi and these two being the inferior colliculi. We're interested in the superior colliculus because that is more concerned with the vision and with the eye movements of the eyeball. Then down below over here, we can see the posterior surface of the pons, and there's an area over here which is basically part of the reticular formation. This is known as the paramedian pontine reticular formation, simply abbreviated as PPRF. It's about 2 millimeter away from the midline, so basically very close to the midline. Now, if you look over here, that the frontal eye field, you can see frontal eye field on the right side is actually connected to the superior colliculus of the midbrain on the right side, right? So it's connected basically to the ipsilateral superior colliculus of the midbrain. But then you can see the fibers crossing over, which is known as the decussation. And these fibers, when they cross over, they get connected to the paramedian pontine reticular formation on the contralateral side, which in this case is the left side, right? The frontal eye field can actually get directly connected with the PPRF as well. So, but the point to be noted over here is that the frontal eye field is connected to the superior colliculus on the ipsilateral side, which is the same side, and is connected to the paramedian pontine reticular formation on the contralateral side, which in this case is the left side. Okay, and similarly, the frontal eye field on the left side will be connected to the superior colliculus on the left side and to the paramedian pontine reticular formation on the right side. Now, if you look at the paramedian pontine reticular formation, you can see that these are then connected to the cranial nerve nuclei, those nuclei which are responsible for the movements of the eyeball. And two of those nuclei are the sixth cranial nerve nucleus, also known as the abducent nerve nucleus, and the third cranial nerve nucleus, also known as the oculomotor nerve nucleus. The paramedian pontine reticular formation is connected to the abducent nerve nucleus on the same side, but then it is connected by a white matter tract which is known as the medial longitudinal fasciculus, or MLF, and through that it is connected to the third nerve nucleus, the oculomotor nerve nucleus of the opposite side. The abducent nerve nucleus is responsible for the movement of a muscle called lateral rectus, which causes the outward deviation of the eyeball. And the Oculomotor nerve nucleus is responsible for the movements of many of the extraocular muscles, but one of that muscle is the medial rectus, which causes the inward deviation of the eyeball. So now what you can see over here is that the paramedian pontine reticular formation, if that gets stimulated, that will cause the deviation of both the eyes onto the side of the paramedian pontine reticular formation, which means deviation is going to be on the same side, right? Because if let's say the left paramedian pontine reticular formation gets stimulated, it will cause the lateral rectus muscle of the same side to contract, causing the left deviation of the eyeball, right? And the outward deviation of the eyeball on the left side, and it will cause through the oculomotor nucleus, it will cause a contraction of medial rectus and hence inward deviation of the eyeball, and this will result in the left deviation of the eyeballs, of both the eyeballs. On the contrary, what you can see over here is that the frontal eye field, the frontal eye field is connected to the paramedian pontine reticular formation on the opposite side, which means that if the frontal eye field on the right side that gets stimulated, that will actually cause the paramedian pontine reticular formation on the opposite side to get stimulated, right? Because there's crossing of the fibers over here. Because of activation of the frontal eye field on the right, the eyeballs would be deviated towards the left, right? Excitation of paramedian pontine reticular formation on the left causes deviation of the eyeball to the left, while activation of frontal eye field on the right causes the deviation of the eyeballs to the left side, which in other words means that the paramedian pontine reticular formation causes deviation of the eyeballs to the same side, but the frontal eye field causes deviation of the eyeballs towards the opposite side, right? Frontal eye field on the left side would cause deviation of the eyeballs towards the right side, and the frontal eye field on the right will cause deviation of the eyeballs to the left side. Since the frontal eye field causes conjugate movement of the eyes towards the opposite side, therefore, in patients who have a destructive lesion in the frontal eye field, such as those who suffer from stroke involving the parietal region, for example, an MCA stroke, the eyeballs they would get deviated towards the side of the stroke or towards the side of the lesion, right, due to an unopposed action of the frontal eye field from the healthy side. For instance, a right MCA stroke, which involves the frontal eye field on the right side, that would actually cause the eyeballs to deviate towards the right side due to unopposed action of the frontal eye field from the left side, which in this case is the healthy side, right? Similarly, a left MCA stroke will cause the eyeballs to deviate towards the left side due to an unopposed action of the frontal eye field from the right side. Right. So in strokes involving the frontal eye field, the involuntary tracking movement of the eyes when following the moving objects, that would however remain unaffected because the lesion does not involve the visual cortex in the occipital lobe. So that is one thing which is important to know, that only the saccadic eye movements, the voluntary saccadic eye movements are going to be impaired. The involuntary pursuit movements would still be intact. Right. Now let's just have a look at this picture over here, and that will actually elaborate this point even more. So for instance, if you look over here, right, see in this patient over here, this blue area basically represents the weakness of the body part. So there's some kind of weakness over here or total paralysis of the right side of the body. And same is the situation over here as well. However, if you look at the eyes here, you can see the eyeballs are deviated towards the left side. Now, how can this situation be explained? Well, this person probably has a stroke in his cerebral cortex on the left side, and that resulted in the weakness of his right half of the body, because the right half of the body is the right half of the body is being controlled by the left side of the brain, and left half of the body is being controlled by the right side of the brain. So if there's a lesion over here, a stroke for instance, then that would lead to paralysis of the right side of the body. However, since the stroke involved the frontal eye field as well, and we know the frontal eye field is pushing the eyeball, is causing conjugate deviation of the eyeballs towards the opposite side. So therefore, because of the unopposed action now of the left frontal eye field, which is the healthy side and is intact and is functioning normally, that is going to push the eyeballs towards the left side. So the eyes get deviated towards the left side because of the healthy frontal eye field on this side, and this frontal eye field is unable to oppose the action of the frontal eye field over here, right? However, since there is a stroke over here, the paralysis would be seen on this side, which is the opposite side, which is the right side. Okay, does that make sense? However, if you look over here, the person has paralysis on the right side, which means there's some kind of a lesion over here. However, the eyeballs periodically, not all the time, but periodically they get deviated towards the right side, which means that now here this person might not have a stroke here, but he might have some kind of an irritative lesion over here, for example a seizure, and that irritative lesion cause the frontal eye field to get hyper excited and push the eyeballs towards the right side, right? However, since seizure doesn't result in a coordinated movement of the body muscles, so it would still present with the paralysis on the right side. So a lesion over here results in paralysis on the right side. However, off and on, that irritation, that irritative lesion, which is the seizure, might actually cause the frontal eye field to on the left side to become activated and push the eyeballs to the right side. So hopefully that will actually help you understand the functioning of the frontal eye field better. So the frontal eye field is basically responsible for the conjugate movements of the eyeballs to the opposite side, and this uh, this information basically helps us in localizing the lesion when we're doing a neurological examination. So to summarize, what we did in this video podcast is we discussed the location of the frontal eye field. We talked about the paramedian pontine reticular formation, superior colliculus, and extra-ocular nuclei, and we discussed how they're connected with the frontal eye field. We discussed that the stimulation of the frontal eye field results in conjugate deviation of the eyes to the opposite side, whereas a destructive lesion results in conjugate deviation of the eyes towards the side of the lesion. This information, we said, is helpful in localizing the neurological lesion.